There's a spot at the base of your skull that most people never think about. It's about 2 finger widths below where your skull ends and your neck begins. Right now, if you're over 60, there's a good chance the muscles at this spot are tight, chronically tight. And that tightness is doing 2 things you probably don't connect. First, it's causing the neck stiffness you feel when you turn your head. Second, it's interfering with your ability to fall asleep and stay asleep. Over 30% of adults aged 65 and older report chronic neck pain. Nearly 50% report poor sleep quality. These aren't separate problems. They're connected by anatomy. The muscles at the base of your skull affect both neck mobility and nervous system relaxation. Physical therapists have known this for decades. There's a simple pressure point technique you can do at home in 5 minutes that addresses both issues. No medication, no special equipment except a tennis ball. In the next 15 minutes, I'll show you exactly how it works and how to do it safely. Let's start with the anatomy so you understand what's actually happening in your neck. The base of your skull sits on top of your first and second neck vertebrae, called C1 and C2. Between the skull and these vertebrae, there's a group of small muscles called the suboccipital muscles, 4 muscles on each side. Their job is to control fine movements of your head. When you nod, yes, these muscles work. When you tilt your head to read, these muscles work. When you look up or down, these muscles control the movement. Here's the problem. Your head weighs approximately 10 to 12 pounds. When your head is balanced directly over your spine, these muscles don't have to work very hard. But most people over 60 spend hours every day with their head positioned forward, looking at a phone, reading, watching TV, driving. When your head moves forward even 2 inches from neutral position, the effective weight your neck muscles have to support increases significantly. Some biomechanical studies suggest that for every inch your head moves forward, it adds 10 pounds of force on your neck muscles. Over time, these muscles adapt to constant tension. They stay partially contracted even when you're resting, even when you're trying to sleep. This creates 2 problems. First, the obvious one: neck stiffness and discomfort. Your range of motion decreases. Turning your head to check your blind spot while driving becomes difficult. Looking up at a high shelf requires your whole upper body to move. Second, the less obvious problem: disrupted sleep. When the muscles at the base of your skull stay tense, they create constant low-level signals through nearby nerves. Your nervous system interprets this as a mild stress state. It's difficult to fully relax into deep sleep when your body is receiving these tension signals. You might fall asleep eventually, but the quality of that sleep is compromised. You wake up multiple times. You don't feel rested in the morning. Now, here's what most people do. They take over-the-counter pain medication for the neck discomfort. They take sleep aids for the insomnia. These provide temporary symptom relief, but they don't address the underlying cause, those chronically tight muscles at the base of the skull. The medication wears off. The tension is still there. You need more medication. This becomes a cycle. There's a different approach. Instead of masking the symptoms, you address the muscle tension directly. You use sustained pressure at specific points to encourage those tight muscles to release. This technique has been used by physical therapists, massage therapists, and occupational therapists for years. The difference is, you can learn to do it yourself at home. Let me explain exactly what happens when you apply sustained pressure to the base of the skull, and why this affects both neck pain and sleep quality. First, the direct mechanical effect on muscle tissue. When a muscle stays contracted for long periods, the muscle fibers can develop areas of persistent tension called trigger points. These are localized spots where the muscle fibers have essentially locked in a shortened position. They don't relax normally. Applying sustained pressure directly to a trigger point for 2 to 5 minutes can help release it. The mechanism isn't fully understood, but the current theory involves several factors. The pressure temporarily reduces blood flow to the area. When you release the pressure, fresh blood flows in, bringing oxygen and nutrients. This helps the muscle fibers relax and return to their normal resting length. The pressure also provides sensory input that may help reset the muscle spindles, which are tiny sensory organs inside muscles that monitor tension and length. Physical therapists use this principle when they do trigger point release work. One, the difference here is that you're using your own body weight and a ball instead of a therapist's hands. Second, the neurological effect on your nervous system. The base of the skull is densely populated with sensory nerve endings. When you apply gentle, sustained pressure here, you're sending specific signals through your nervous system. These signals can activate what's called the parasympathetic nervous system. This is the part of your autonomic nervous system responsible for rest, digestion, and recovery, the opposite of the sympathetic fight or flight response. When the parasympathetic system activates, several things happen. Your heart rate may decrease slightly, your breathing may slow and deepen, your blood pressure may decrease slightly, stress hormone production decreases. These are the physiological conditions that support falling asleep and staying asleep. This is why the technique works particularly well when done before bed. You're essentially giving your nervous system a clear signal that it's time to shift into rest mode. Third, the postural effect over time. When you consistently release tension in the suboccipital muscles, your head position often improves. Your head may sit more balanced over your spine during daily activities. This is important because it creates a positive feedback loop. Better daytime posture means less strain on the neck muscles throughout the day. Less daytime strain means less tension accumulating by evening. Less evening tension means better sleep and less morning stiffness. The research on manual pressure point techniques shows mixed results, but several studies have found benefits. Some research on acupressure and trigger point release suggests these techniques can reduce muscle tension and improve subjective reports of pain and sleep quality. The effects appear to be most consistent when the technique is done regularly over several weeks rather than as a one-time treatment. It's important to understand what this technique is and isn't. It's not a cure for serious medical conditions. It's not a replacement for medical treatment if you have a diagnosed neck disorder, sleep disorder, or other health condition. It's a self-care technique that addresses muscle tension through mechanical pressure and nervous system signaling. Think of it like stretching. Stretching doesn't cure injuries, but regular stretching can improve flexibility, reduce muscle tightness, and help prevent some types of strain. This pressure point technique works similarly. It's a tool for managing muscle tension that contributes to neck discomfort and sleep difficulty. In the next section, I'll give you the exact step-by-step instructions so you can try this safely tonight. Here's the complete beginner technique with detailed instructions for safe, effective practice. What you need: a chair with a back tall enough to support your head, a standard tennis ball approximately 2.5 inches in diameter, and 5 minutes of uninterrupted time. Finding the pressure points. Sit upright in your chair. Reach back with your fingers and locate the base of your skull. You'll feel a hard bony ridge running horizontally. This is the occipital ridge. The primary pressure point is approximately 2 finger widths below this ridge, all in the muscular tissue between the skull and the upper neck vertebrae. You're looking for the soft tissue, not bone. When you press gently with your fingers, you may feel some tenderness or tightness. That's the target area. The second point is approximately 1 inch lower, still in the upper neck region but below the first point. Setting up the technique. Take your tennis ball and position it between the back of your head and the chair back. Place it at the first pressure point location you just identified. Sit back slightly so the ball is held in place by your body weight against the chair. Adjust your position until you feel steady, tolerable pressure at the target point. The pressure should feel like a firm massage, uncomfortable but not painful. If you feel sharp pain, you're pressing too hard. Sit more upright to reduce the pressure angle. If you feel almost nothing, you may need to lean back more or adjust the ball position slightly up, down, left, or right. Holding and breathing technique. Once you've found the right position and pressure level, stay there for 2 full minutes. Don't move around or adjust position during this time. Breathe steadily. Inhale slowly through your nose for a count of 4. Exhale slowly through your mouth for a count of 6. Keep repeating this breathing pattern. The longer exhale activates the parasympathetic nervous system more effectively than equal inhale and exhale. Don't hold your breath. Don't tense your shoulders or jaw. Try to relax everything except what's needed to maintain your seated position. What you might feel during the hold: warmth spreading through the back of your neck and possibly into your shoulders, a gradual softening or release sensation in the tight muscle, possible mild tingling which indicates increased blood flow, or temporary increase in tenderness for the first 30 to 45 seconds before it begins to decrease. All of these are normal responses. Moving to the second point. After 2 minutes, sit up and move the ball approximately 1 inch lower on your neck. Lean back into position again. Hold this second point for another 2 minutes using the same breathing pattern. This second position targets slightly different muscle groups in the upper neck that also contribute to overall neck tension. Post-technique movement. After completing both 2-minute holds, remove the ball and sit upright. Perform gentle neck mobility movements. Slowly turn your head to look over your right shoulder. Return to center. Turn to look over your left shoulder. Return to center. Repeat 5 times in each direction. Tilt your right ear toward your right shoulder. Return to center. Tilt your left ear toward your left shoulder. Return to center. Repeat 5 times each side. These movements help integrate the release you just created and give you immediate feedback about improved range of motion, timing, and frequency. Do this technique 6 nights per week before bed. Consistency matters more than duration. 5 minutes done regularly produces better results than occasional longer sessions. Go to bed within 20 minutes after finishing the technique. Your nervous system is primed for sleep. Don't start stimulating activities. Safety considerations. Do not use this technique if you have osteoporosis or significant bone density loss, recent neck injury or whiplash, herniated cervical discs, cervical spine instability, or severe arthritis in the neck. If you have any of these conditions, consult your physician or physical therapist before trying this technique. For most people without these conditions, this is a safe self-care practice when done as described. Now, let's examine why a mechanical approach to muscle tension offers advantages over relying primarily on medication for neck-related sleep problems. Understanding medication limitations. Over-the-counter sleep aids typically contain antihistamines like diphenhydramine or doxylamine. These medications cause drowsiness as a side effect of their primary antihistamine action. They can help you fall asleep, but research suggests they may alter sleep architecture. Some studies indicate reduced time in REM sleep and deep slow-wave sleep stages. The result is, you may sleep for 7 or 8 hours, but wake feeling unrefreshed because the quality of that sleep was compromised. Additionally, these medications can cause next-day drowsiness, dry mouth, constipation, and urinary retention, particularly in older adults. The American Geriatric Society lists antihistamine sleep aids as potentially inappropriate medications for older adults due to these side effects. Muscle relaxants present similar issues. Medications like cyclobenzaprine work on the central nervous system to reduce muscle tension. They provide temporary relief, but don't address why the muscles became tense. When the medication wears off, typically within 6 to 8 hours, the underlying muscle tension often returns. Long-term use can lead to dependency where you need the medication to feel comfortable. Some muscle relaxants also cause significant drowsiness, dizziness, and increased fall risk in older adults. The Centers for Disease Control and Prevention notes that medications are a contributing factor in many falls among older adults. The mechanical alternative. The pressure point technique addresses the problem differently. Instead of chemically altering your nervous system or muscle function, you're using physical pressure to encourage tight muscles to release. This works with your body's natural mechanisms rather than overriding them. When you release muscle tension mechanically, several things happen. The localized pressure encourages increased blood flow to the area when you release the pressure. Yes, fresh blood brings oxygen and nutrients that support normal muscle function. The sustained pressure provides sensory input that can help reset abnormal muscle tension patterns. The release of muscle tension reduces the stress signals being sent through nearby nerves to your brain. Your nervous system can shift more easily into parasympathetic mode. These effects don't depend on a medication being active in your system. They result from changing the actual physical state of the muscle tissue. The relief can last for hours or into the next day because you've addressed the source of the problem, not just masked the symptom. Cost comparison over time. Consider a typical scenario. Someone spending $40 per month on over-the-counter sleep aids and pain relief products. Over 1 year, that's $480. Over 5 years, or $2,400. The pressure point technique requires a tennis ball. Approximate cost, $3 to $5. One ball can last for years. Even if you replace it annually, the 5-year cost is $25 versus $2,400. But the real comparison isn't about money. It's about addressing root causes versus managing symptoms. Side effect profile. The pressure point technique, when done correctly, has minimal side effects. Possible temporary soreness in the neck muscles, similar to post-exercise muscle soreness. Some people experience mild headache during the first few sessions as circulation patterns change. These typically resolve within a few days of consistent practice. Compare this to medication side effects: daytime drowsiness, cognitive fog, dry mouth, constipation, urinary problems, the increased fall risk, and potential drug interactions with other medications. For many people dealing with tension-related neck pain and sleep difficulty, the mechanical approach offers a more sustainable long-term solution. This isn't anti-medication. Medications have important uses. But for muscle tension that's causing pain and interfering with sleep, addressing that tension directly makes physiological sense. You're working with your body's natural ability to release muscle tension and activate relaxation responses rather than chemically suppressing symptoms. Here's the intermediate level protocol for people who have practiced the basic technique consistently for at least 4 weeks and want to enhance the effects. This builds systematically on the foundation you've already established: extended hold times and additional positions. Increase the hold time on your first position from 2 minutes to 3 or 4 minutes. Research on trigger point release suggests that longer sustained pressure, up to 5 minutes, can produce deeper muscle release. However, start with 3 minutes and only extend to 4 or 5 if 3 minutes feels comfortable. Increase the hold time on your second position from 2 minutes to 3 minutes. Add a third position, approximately 2 inches below the base of the skull, in the middle neck region. This targets muscle groups that connect the upper neck to the mid-neck and upper back. Hold this position for 2 minutes. Your total pressure point time increases from 4 minutes to 8 to 10 minutes. Use this extended protocol particularly after days involving prolonged sitting, extensive screen time, or unusual physical demands. Preparatory movements before pressure point work. Adding movement before the pressure point technique warms up the tissue and increases circulation, which can enhance the effectiveness of the pressure release. Seated neck rotations. Sit with upright posture. Slowly rotate your head to trace a circle, as if your nose is drawing a circle on the ceiling. 10 slow rotations clockwise, 10 slow rotations counterclockwise. Move slowly enough that the rotation takes about 5 seconds to complete. Lateral neck stretches. Tilt your right ear toward your right shoulder until you feel a gentle stretch on the left side of your neck. Hold for 10 seconds. Return to neutral. Tilt left ear toward left shoulder. Hold 10 seconds. Repeat twice on each side. Forward neck stretch. Gently lower your chin toward your chest, allowing the weight of your head to create a mild stretch at the back of your neck. Hold for 15 seconds. Don't force the stretch. Just let gravity work. These preparatory movements take approximately 3 minutes total. They increase tissue temperature and blood flow, preparing the muscles for deeper release work. Enhanced breathing pattern during holds. Shift from the simple 4-6 breathing pattern to box breathing, which has been shown in some research to more strongly activate parasympathetic nervous system responses. Inhale through your nose for 4 seconds. Hold your breath for 4 seconds. Exhale through your mouth for 4 seconds. Hold empty for 4 seconds. Repeat this cycle continuously throughout each pressure point hold. Box breathing requires more attention than simple slow breathing, which also helps focus your mind and prevent it from wandering to stressful thoughts. Post-technique strengthening and mobility work. After completing all pressure point holds, add these exercises to help maintain the release you've created and build strength that supports better posture. Chin tucks. Sit tall with neutral spine. Pull your chin straight back, not down, as if making a double chin. You should feel the back of your neck lengthen. Hold for 5 seconds. Relax. Repeat 10 times. This exercise strengthens the deep neck flexor muscles. When these muscles are strong, they help maintain proper head position over your spine, reducing chronic strain on the suboccipital muscles. Shoulder blade squeezes. Pull your shoulder blades together behind you, as if pinching a pencil between them. Keep your shoulders down, all not hunched up toward your ears. Hold for 5 seconds. Relax. Repeat 10 times. This addresses upper back and shoulder muscle tension that often accompanies and contributes to neck problems. Tightness in these areas pulls on neck muscles and perpetuates the tension cycle. The complete intermediate protocol takes approximately 15 minutes. 3 minutes preparatory movement, 8 to 10 minutes extended pressure point, holds with box breathing, 2 to 3 minutes post-technique strengthening and mobility work. Expected progression at this level. Many people practicing at this intermediate level for 4 to 8 weeks report significant improvements. Neck pain that was daily often decreases to occasional discomfort. Sleep onset time frequently improves, with people falling asleep 10 to 15 minutes faster than before starting the practice. Night wakings often decrease. Morning neck stiffness typically reduces by 50% or more compared to baseline. Range of motion in neck rotation and lateral bending usually shows measurable improvement. Here's the advanced protocol, a comprehensive evening routine that integrates the pressure point technique with other evidence-based practices for neck health and sleep quality. This level is designed for people dealing with chronic neck tension or persistent sleep difficulties who want a complete systematic approach. The routine begins hours before the actual pressure point work and addresses multiple factors that influence both neck health and sleep. 6 p.m. Environmental preparation. Begin reducing light intensity in your home. Research on circadian rhythms shows that bright light exposure in the evening can suppress melatonin production and delay sleep onset. Use table lamps or dimmer switches instead of bright overhead lighting. Limit screen use after 8 p.m. The blue wavelength light emitted by phones, tablets, and computers has been shown in multiple studies to interfere with melatonin production. If you must use screens, consider blue light filtering glasses or screen filters. 8:30 p.m. Gentle movement practice. Take a 10-minute walk at comfortable pace. Walking promotes circulation throughout the body, including the neck and shoulder region. It also provides a mental transition from daytime activities to evening wind down. After walking, perform gentle whole-body stretching, cat-cow spinal movements, if comfortable on hands and knees, yet alternate between arching your spine upward and allowing it to sag downward. 10 slow cycles. This mobilizes the entire spine, not just the neck. Child's pose. Sit back on your heels with arms extended forward, forehead resting on the floor or a cushion. This position gently stretches the back and neck. Hold for 1 to 2 minutes. Gentle seated spinal rotations. Sit in a chair. Place your right hand on the outside of your left knee and gently rotate your torso to the left. Hold 15 seconds. Repeat on the other side. These movements require approximately 10 minutes and prepare your entire body for deeper relaxation. 9 p.m. Extended pressure point session. Perform the intermediate level protocol with all 3 positions and extended hold times. Use box breathing throughout. Total time, 10 to 12 minutes. Optional enhancement, aromatherapy with lavender. Some research suggests lavender scent may promote relaxation and improve sleep quality. Place a drop of lavender essential oil on a tissue near you or use a diffuser. 9:15 p.m. Post-technique practices. Hydration with possible supplementation. Drink 8 ounces of warm water. Some people find that magnesium supplementation helps with muscle relaxation and sleep. Magnesium plays important roles in muscle function and nervous system regulation. However, consult your physician before starting any supplement, as magnesium can interact with certain medications and may not be appropriate for people with kidney disease. Brief self-massage. Use your fingertips to massage the sides and back of your neck with small circular motions for 2 to 3 minutes. This extends and reinforces the release from the pressure point work. Floor sitting practice if able. Sit cross-legged on the floor or on a cushion for 5 minutes. The ability to safely get down to and up from the floor is associated with functional independence and lower mortality risk in older adults. Regular practice maintains this important functional capacity. 9:30 p.m. Sleep environment optimization. Bedroom temperature. Research suggests that cooler room temperatures, approximately 65 to 68 degrees Fahrenheit, support better sleep quality. Light elimination. Make your bedroom as dark as possible using blackout curtains or an eye mask. Even small amounts of light can interfere with melatonin production. Noise control. Use earplugs or a white noise machine if your environment has disruptive sounds. And sleep position for neck health. Back sleeping with a thin pillow or side sleeping with a pillow that keeps your head aligned with your spine are both acceptable. Avoid stomach sleeping, as this requires neck rotation for extended periods. This complete routine requires approximately 60 to 70 minutes from start to finish. You don't need every element every night, but the combination produces optimal results. Let me summarize the complete progression system. Level 1. Basic technique. 5 minutes before bed. Tennis ball on a chair. 2 positions at the base of the skull. 4-6 breathing pattern. This addresses the fundamental muscle tension, causing both neck discomfort and sleep difficulty. Level 2. Intermediate practice. Extended holds, 3 positions, preparatory movement, box breathing, post-technique strengthening. 15 minutes total. This deepens the muscle release and builds strength to support better posture. Level 3. Comprehensive evening routine. Environmental preparation, whole body movement, extended pressure point work, optimal sleep environment. This addresses all factors contributing to neck tension and sleep quality. Start with level 1 tonight. Get a tennis ball. Find the spot 2 finger widths below the base of your skull. Lean back into a chair. Hold for 2 minutes. Notice what you feel. Track your neck mobility and sleep quality over the next week. This is an educational technique used by physical therapists. It addresses a mechanical problem with a mechanical solution. Simple, effective, evidence-based.